The next two are Roxanne Wilson, our County Homeless Services Director. This is item 16 is our accomplishments of homeless strategies and initiatives over the 24 to 25 and 25 to 26 years.
Good afternoon, Honorable Chair, members of the board, and members of the public. My name is Roxanne Wilson, and I'm the County Homeless Services Director for the County of Monterey. We are nestled in the County Administrative Office. Today, I'm pleased to provide an update on the accomplishments and achievements of the CAO's Homelessness Strategies and Initiatives Division over the past 2 years, and to highlight the work underway to strengthen the county's homelessness response system. The Homelessness Strategies and Initiatives Division is intentionally small, but its responsibilities are broad and county-wide in scope as we sit in the County Administrative Office. Unlike some of our county partner departments, we do not have social workers or case managers, and we do not provide direct services to people experiencing homelessness. The division is led by the County Homeless Services Director and supported by management analysts who focus on critical but macro level areas. Because homelessness touches nearly every part of local government, our staffing model requires each team member to work across multiple disciplines. Our work includes program planning, funding administration, contract oversight, policy development, public communication, encampment response, interagency coordination, and system improvement. Although we are a small team, the division is a central coordinating body for the county's overall response to homelessness. The core functions of the division fall into 5 primary areas. The first is planning and implementation. We evaluate the county's various strategic planning goals related to homelessness and make recommendations to department heads, the county administrative officer, and the Board of Supervisors in ways that we could improve the county's approach to addressing homelessness. We work to establish and maintain a framework that supports a comprehensive response through a strong interdepartmental and interjurisdictional coordination. We promote, manage, and evaluate systems integration. We develop and align countywide policies to support a more consistent and effective homelessness response. And last, but one of the most important easily, is that we actively work to establish partnerships and alliances with various internal and external stakeholders, including other county departments, the Housing Authority of the County of Monterey, community-based organizations, the Managed Care Plan, other jurisdictions, including state and federal partners. One of the things that I do want to talk about briefly is that our system in Monterey County, not just the County of Monterey, but our entire region, is highly decentralized. There is no one single agency that controls most or all of the funding, programs, housing resources, data systems, the policy levers needed to address the policy levers needed to address homelessness. This is not necessarily a bad thing, but it does mean that we have to be incredibly intentional on how we approach the issue. The County Administrative Office, the Housing Authority, the Department of Social Services, the Coalition of Homeless Services Providers, Department of Health Services, Behavioral Health, the City of Salinas, we all have very important but different roles in the system. And the role of our division is not to replace any of these partners, but to help us align the work, identify gaps, improve coordination, and support a more strategic and accountable response. There's a lot of stakeholders on this screen. In addition to the core partners shown on the previous slide, homelessness requires coordination with a much broader network of stakeholders beyond our efforts with nearly all of the county's departments. We also partner with hospitals, medical managed care plans, street medicine providers, education partners, faith-based organizations. And at the state and federal level, our work intersects with state HCD, the Department of Healthcare Services, California Department of Social Services, Cal-ICH, Caltrans, HUD, and VA. This broad network demonstrates why homelessness cannot be solved by one department, one jurisdiction, or one funding source. It requires a coordinated system response and constant evaluation and course correction. The 2024 point in time count identified 2,436 individuals experiencing homelessness in Monterey County. That equates to approximately 56 people per 10,000 residents. By comparison, the state of California has approximately 46 people per 10,000. The data reinforces the need to continue investing in shelter, interim housing, permanent housing, outreach, healthcare connections, behavioral health supports, and prevention strategies. The division has put a lot of effort into reducing homelessness over the past few years, and preliminary numbers for 2026 appear to be in our favor. A formal presentation to the board will be scheduled upon your return in around August or September. One of the division's most significant accomplishments has been the development of a more strategic encampment response framework. This includes the development of a board-adopted encampment resolution policy, which provides a more consistent and human-centered approach to addressing encampments within the county's jurisdiction. We do not, I just feel like I have to say this, we do not have authority of what happens in areas that are not within our jurisdiction. We have established an encampment response team to support coordination across multiple departments and partners, and we do meet every other week. We work to establish and maintain, that's what I get for this. Give me a second. The division launched a public-facing encampment concern forum to create a more transparent and organized way for the public to report encampments. We also developed an interagency encampment management portal to improve coordination, documentation, and communication across partners, both internal and external. But most importantly, we have moved toward targeted approaches to resolving some of the largest and most complex encampments in the county's jurisdiction. The goal is not simply to move people from one location to another. The goal is to connect people to services, shelter, interim housing, permanent housing, and long-term stability whenever possible. The county has pursued several targeted encampment interventions, each requiring significant partnerships, funding, and coordination. For the Pajaro River area, we partnered with Santa Cruz County, the City of Watsonville, Central California Alliance for Health, the Pajaro Regional Flood Management Agency, and the Community Action Board. The county secured approximately $8 million in encampment resolution funding and $1.2 million from Central California Alliance for Health. These resources supported the development of a 34-bed low-barrier navigation center in the City of Watsonville, which is now fully occupied. This project presents a significant regional partnership and provides a safer, service-connected, housing-focused alternative for individuals experiencing homelessness in the Pajaro River area, and it does assist us with clearing out the river so that PERFMA can start doing their levee expansion work. And in King City, the county partnered with the City of King, the Housing Authority, the Coalition of Homeless Services Providers, the Health Department, Central California Alliance for Health, Social Services, State HCD, and Step Up. The county secured $6.4 million in encampment resolution funding, which represents approximately 37% of the total project budget. This effort includes temporary shelter at a local motel and the development of a 45-bed permanent supportive housing project in King City. Lease-up is currently in progress and the project is partially occupied. This is a major achievement because it connects encampment residents directly into permanent supportive housing outcomes. These individuals will no longer be counted in our homeless point in time count. They are considered housed, and that encampment has been cleared. And of course, in Soledad, the county partnered with the City of Soledad and Step Up on Second. The county secured $4.7 million in ERF funding. This effort resulted in the removal of approximately 380 tons of trash and debris from the Salinas River. 15 people, have been permanently housed, and the permanent closure of the encampment, which had severe impacts to the environment. As part of a multi-pronged strategy, we created a 16-unit non-congregate interim housing facility, which is now occupied. This is an example of what is possible when encampment response is paired with housing and strong services, because it was not just the ERF funding or office that had done this. Public Defenders has a Prop 47 project, Prop 47 grant that has also assisted with this project. All of the clients, except for I believe one, was enrolled in CAO-HSI, and behavioral health has helped substantially with this project. Excuse me. So to date, King City and the Soledad encampment, which has been around for as long as I have been working on homelessness, really, has been completely resolved, and individuals have all received services. The Pajaro River, it's a very large encampment, but we are constantly working through it, and so far 5 people have been housed, and there are 4 people that are currently in queue for permanent housing. That's just with the Low Barrier Navigation Center. We started working to house people long before the LBNC was, or Hope Village was opened. Let's see, sorry. Notes. In addition to direct project implementation, the division has focused heavily on improving system performance and accountability. We developed a countywide Housing First homeless management information system and coordinated entry contract exhibits. These exhibits help ensure that county-funded programs are aligned with federal and state requirements as well as local expectations. The board adopted a Housing First resolution reinforcing the county's commitment to evidence-based practices. The board also adopted a shelter crisis declaration, which supports the county's ability to to respond to urgent shelter needs. We developed standardized benchmarks and outcome goals, which I will be presenting to you at our very next item on today's agenda. And of course, you've seen that we've increased accountability through even the Share Center MOU with the City of Salinas. And together, all of these pieces are efforts to help shift the system towards improved performance, transparency, and results. And then initiatives that are currently in progress are really significant. We still have a lot of work ahead of us, of course. Current initiatives include identifying and developing a safe parking program as per the board's direction in North Monterey County. We're also working to develop a permanent supportive housing project for 18 to 24-year-olds who have children of their own and they are experiencing homelessness. That will be in Soledad. The county is pursuing an encampment resolution funding round 5 application with the City of Salinas, and that will be focusing on what we call the Davis Road corridor, starting from Blanco all the way to Baranda and all of the encampments within that area. We are working to develop shelter options for unhoused individuals who are being discharged from hospitals, which is a huge gap in our system. Oftentimes, individuals they get discharged from hospitals, they just need a place to recover and recuperate. And actually, it's more of a burden on taxpayers if we allow them to be discharged back onto the streets, because individuals tend to cycle in and out of emergency rooms. It is so much easier, so much more effective, and honestly cheaper if we just get them directly into a shelter bed. Another major body of work is customizing the homeless management information system so it can support Medi-Cal billing and CalAIM reporting. And finally, we're developing standard scopes of work for homelessness interventions so that the countywide contracts are aligned with best practices, benchmarks, and outcome goals. These initiatives are designed, again, to continue to build capacity across the system while also improving accountability and outcomes. Our efforts over the past 2 years align with 15 of the 17 key strategies in the Lead Me Home plan. This includes increasing participation in homelessness solutions by leaders and key stakeholders across the region, investing strategically, building political will for affordable housing, improving the performance of the homelessness response system, expanding mobile outreach, expanding housing solutions, and supporting people so that they retain their housing. It also embraces Housing First diverse, implements performance-based performance measurements and continuous quality improvement, providing safe temporary locations for people to stay and connecting unsheltered people to housing. This alignment is important because it demonstrates that the division isn't working in isolation. Our work is directly tied to the region's adopted strategic plan and broader system goals. In closing, the Homelessness Strategies and Initiatives Division has made significant progress in building a stronger, more coordinated, and more accountable homelessness response system for Monterey County. Since its establishment, the division has helped secure and implement major state funding, develop new housing and shelter interventions, support targeted encampment resolution, strengthen county policy, improve contract accountability, and advance system-wide coordination. At the same time, homelessness remains a complex and urgent challenge. The need continues to exceed available resources, and the county cannot solve this issue on its own, which is why we partner so heavily with all of the stakeholders in our community. Continued progress will require sustained partnership, strategic investment, and strong accountability. Thank you so much for this opportunity to provide this update, and this concludes my presentation. I'm open for any questions.
Thank you, Roxanne. And to your whole team, thank you. Is there any public comment on this item? I'm not seeing any public comment. We'll bring it back to the board. Glenn?
Just want to thank you for all the great work that you've done over the last few years. It's you have one of the most challenging tasks ahead because it's this isn't just a local problem. It's a state problem. It's a national problem. The resources aren't always there, and when they are there, there's challenges, as you've experienced, because there's opposition that appears unexpectedly at times. But just anyway, just thank you for the report, the update, and looking forward to what you can achieve here in the next few years as well. Thanks.
Thank you.
Just a couple specific questions. Thank you so much, Roxanne. That was a really great presentation. When you showed the slide that had Pajaro and King City and Soledad, and you talked about those 3 successful projects, if you were to articulate like how you got to closure, what were the interventions that were so effective in getting folks? I mean, you said some of them had been encampments that were open for many, many years. And I know sometimes it's really hard to make that transition. So you were successful is one question. What interventions would you cite as being the most successful? And then number 2, are we concerned, since we're looking at a point in time count that seems to be going up, that those encampments will reestablish themselves? And is there anything we're doing to try to get in front of that?
Actually, we are anticipating the point in time count will go down.
Okay, good. We're going to get a presentation.
You will be getting a presentation.
Okay.
The numbers are looking very favorable for our continuum of care region, which is us and San Benito County. And we've been very, very focused on unsheltered homelessness and getting people connected into shelters and other types of housing. I will say that the most successful component of all of the projects that we had is actually working with the people who were in the encampment. So the city of Soledad is incredible as a jurisdiction. They hired staff specifically to assist us with this effort, and those staff spent quite a bit of time inside the encampment. They have taken the entire encampment out to lunch and really explained to them why we have to move forward with resolving the encampment and learning from the people about exactly what they need in order for them to resolve their homelessness. We are currently down, of the 40 people in the city of Soledad, or it's not really the city of Soledad, the encampment spanned over Caltrans property, Monterey County property, private property, public property, and the city of Soledad. So it's already a complex area. When we had started moving forward with this, it was so important for us to understand each individual that was there, how long they've been experiencing homelessness, whether they're undocumented or not, what other resources are they connected to, and are they currently working, and then also engage with them about, well, what do you think it's going to take? Of the 40 individuals that was in that encampment, we are currently down to 11 left. 5 of those individuals are slated to move into our King City project, which will leave us 7. And those individuals, we are working very closely, well, we meaning the group, working very closely with Monterey County Behavioral Health for us to address some of those higher acuity concerns of the remaining clients that are there. Communication is important. Treating people like they're human, really important. And listening to them and all of their concerns of how they feel like they got there. And again, what it's going to take. In the presentation that I have for you later on, we'll get to really explore which interventions are the most successful and also the most successful at keeping people housed. But the end game should always be permanent housing. Always. We should not just open a shelter and allow people to stay in perpetuity. We have to look at each person, create client-centered plans, and build our entire service provision off of what that particular client needs. Soledad is a special place. I just want to acknowledge that. It's just a scrappy little community where everybody works so closely together. And I think that that was one of the benefits. We meet with the city manager every week. And, you know, in larger jurisdictions, you don't get that proximity to the city manager. So South County's cool.
One more question then on, I mean, each of those encampment interventions had either a permanent or an interim housing component. So much of what you talked about, the success was in that interagency and regional collaboration. In terms of interagency collaboration, and I think, I mean, in terms of when there is not an accompanying either permanent or interim housing solution, how can we strengthen the collaboration with other agencies and partners, like, say, the Housing Authority? Is there more that you could elaborate on what we could be prioritizing or supporting as a board to help this placement into permanent housing where it exists when there isn't a corresponding program like we had in these 3 examples?
What I've learned since I've started working on addressing homelessness in this community is no is never really no. It's oftentimes not right now. So I tend to not give up on a lot of things that I just recognize as a major gap in our system. I think with the Housing Authority specifically, without speaking on behalf of them, but what they're going through right now is a lot of turbulence. There's so much uncertainty with the federal government and how much funding is going to come down. There's also a lot of uncertainty on whether or not the federal government is going to continue to allow mixed households. So right now, I feel like that is probably a focus that if I was the executive director, that's all I would be caring about, is how are we going to manage the possibility of easily thousands of people not being able to live inside of the housing that they're currently being placed in. I remember when I first came to this county 4 years ago now, I remember talking to our former social services director and also our current health services director, and we talked about things like recuperative care, and we were just kind of lightly talking about it, and now the state has really bought into it, and that need still exists. So again, it wasn't a no, we didn't have the resources then, but now the resources are available. So there's so many things to do when it comes to homelessness, that again, if it's not right now, that's fine, because there's 10 other things that we could focus on. But I do recognize that it is important for us to possibly explore formal MOUs with organizations like the Housing Authority, for us to explore where their priorities are, just to make sure that we are constantly in front of them and reminding them of this particular population, so that they're not left behind.
Great answer. Thank you.
Yeah, thank you. I'm really glad that you brought this forward. I know this was like on our agenda for some time and it got, bounced around. But I think it's important for the community to hear the work that's happening, because so often it can feel like it's not enough. And I know I feel that way, and I'm sure you must feel that way, that the needs are greater and we need to do better and do more and faster, and the tension that exists to find that balance of like, let's actually build the system that's going to achieve the goals that we have. I just can't say enough about the Lead Me Home plan, and I'm really pleased that that has provided like a shared vision, a shared path for the county and some of our partners to work collectively towards. I think the fact that we continue to talk about it, the fact that it is not just a plan that was developed and put on a shelf, but has been a guiding path for collective action forward, is significant. And so thank you. Also, I know you were at the helm of trying to get us all aligned on that as well. And as we think about the partnerships and we think about the strategies that to invest in moving forward, I just will finally say, like, I think that what you said about that it's important that we treat people like people, and that we approach people with the type of respect that and kindness and care and compassion. For so long, our only strategy was, we'll go into an encampment and offer 3 days in a hotel, and yet all your belongings are going to disappear. And then we would say we've offered people services and they don't want services, when that really truly couldn't be farther than the truth. And I think the work that you've done to say, hey, listen, when you actually meet people where they're at and you listen and you connect and you build trust, and then you figure out how to provide people with what like they actually need when they need it. There's a respect and a trust building that comes with that. That's fundamental to every value that we talk about holding here in this community. But to see it put into action in a way where it actually delivers outcomes for our individuals who need those outcomes, and for the rest of the community who's there to be positive outcomes for everyone. I just thank you, Roxanne, for bringing that humanity and kindness and compassion into this very difficult work. So I just appreciate the team that's here, and appreciate all the partners who are working in partnership. The only question that I have is really around, and we'll talk about the Behavioral Health Services Act later, but as we look at the state's funding challenges that we heard about earlier this morning, and this realization that some of the HEAP dollars may not continue flowing, but that we're being told, go look at the MHSA or the BHSA funding, but also recognizing that the BHSA housing portion only allows a very small percentage of that, I think 25%, I could be wrong on that, to be spent on capital housing projects. Can you just speak at all to like how we moving forward over the next year are going to be working in coordination to align that plan with our larger efforts?
I think that BHSA is so different than what the county has had access to before. And to be honest, it's a beast. When I went through the county guide, I believe it's like 300 pages long. It's insanely dense. And there's a lot of moving pieces. And of course, that is a part of a larger strategy, which includes the CAO-AIM initiative. It includes the Justice Involve initiative. All of these pieces are supposed to move in together. And I say that because I do want to just honor that our behavioral health and health services team has so much to really to understand, and how this new this new world is going to impact not just the MHSA organizations that are no longer going to be funded, but also how does this brand new piece of funding impact the rest of the homeless sector? So I say that in a way to where I say there's still so much work to do, so much opportunity. I do have the opportunity to meet with the health department next, I believe it's next week, or maybe it's 2 weeks from now, for us to start off with the outreach component. How are we going to start leveraging outreach that health services already does, behavioral health already does, and essentially marry it to what we are doing on the homeless services side? What I've identified is that the access for people experiencing homelessness into behavioral health services is probably the most difficult thing, because people who are living underneath a bridge for 10 years, they're not going to pull out their iPhone and look at their calendar and say, oh, I have an appointment, let me jump inside of my car and drive over to Salinas to go there. So this is where the homeless sector can help, because we do have people on the streets who can transport, but we just need to increase that communication and make sure that people have access to getting those assessments, meeting them where they actually are, and not, and really thinking about their circumstances. So we have a lot of building to do, but I am very confident that we will get there.
Great, thank you. I think we're just receiving this report. So
Yes.
Unless there's other feedback, I think we're good. And we can move on to item number 17, which is to receive a presentation on proposed standardized homelessness response system performance benchmarks and outcome goals.
Hi, it's me again. So again, I am Roxanne Wilson. I'm the Homeless Services Director for the County of Monterey. Today, I am proposing that the county adopt standardized system performance measures and outcome goals. The purpose of this presentation is to provide an overview of why these measures are needed, how they align with existing state, federal, regional, and local frameworks, and make recommendations accordingly for your before your board today. So I know you just heard so much of this language, but must repeat. The role of our division is to develop, plan, administer, direct, evaluate, and coordinate the county's initiatives to address homelessness. A core part of that role is monitoring and evaluating the efficiency and effectiveness of homelessness initiatives, policies, programs, and contracts. This includes developing qualitative and quantitative measures that allow us to understand whether programs are meeting expectations, whether public investments are producing the intended outcomes, and where improvements may be needed. Over the past several years, our office has worked closely with partners to better understand the county's current homelessness response system, the data available to us, and the areas where stronger alignment is needed. This included reviewing HUD system performance measures, California system performance measures, the Lead Me Home plan, goals, grant application goals, local contract requirements, and data from the homelessness management information system. We've also engaged with key partners, including the Department of Social Services, City of Salinas, County of San Benito, because again, we are a part of a 2-county continuum. And also people with lived experience, direct service providers. In 2025, we hired a E-Decolony, I can never say that correctly, E-Decolony Consulting, who assisted us with the development of contract monitoring tools. Excuse me. Through this initial assessment with the consulting team, we identified several issues. First, the homeless service programs currently operate under different reporting requirements, different definitions of success, and outcome expectations. This creates inconsistent performance standards across all of the county's departments, programs, and funding sources. Second, these inconsistencies limit accountability and transparency. Without a unified framework, it is difficult for us to measure program effectiveness, compare outcome goals across interventions, and clearly analyze the return on public investment. Third, the lack of standardization makes data-driven decision-making more challenging. When programs are not measured against shared goals, it becomes harder to prioritize resources and invest in interventions that produce the strongest housing outcomes. Ultimately, we identified the need for system-wide alignment. Standardized performance measures will create a unified accountability framework that strengthens coordination, improves transparency, and aligns programs with regional goals and long-term objectives. The first framework we reviewed is the HUD system performance measures. These measures are reported by our Continuum of Care, which is led by the Coalition of Homeless Services Providers. And again, for our community, that the COC is Monterey and San Benito counties. Please note that Measure 6 does not pertain to Monterey County, and therefore it has been left out of this report. Measure 1 looks at the length of time people experience homelessness. This is important because reducing the amount of time someone remains homeless is one of the clearest indicators of whether or not a system is functioning effectively. The longer someone remains homeless, the more difficult it can become to stabilize their health, their income, and housing outcomes. The measure only looks at those who had positive housing outcomes. So essentially, this data is pulled from the Homeless Management Information System, which is mandated by the state and federal government, that all homeless service providers put data on clients in there. The way HMIS reads data is interesting, but it is incredibly robust. And in this particular case, it's only looking at, of all of the interventions that are inside of that system, how many people were exited to permanent housing, and how long did it take for those organizations to house them. What we can tell by this particular measure is that if, of course there are outliers, but if we are going to have a permanent housing outcome, it's going to happen within the first 6 months. That's what this data tells us. Measure 2 looks at exits to permanent housing and the rates of returns to homelessness over a 2-year look back. This one is really difficult to read because it does go back in time. But essentially, this tells us not only whether people are being housed, but whether or not those housing placements are stable over time. This measure looks at all housing interventions, including street outreach, rapid rehousing, transitional housing. So it is kind of like a all-in-one measure assessment. Measure 3 looks at the number of people experiencing homelessness. This is almost like a region's report card, oftentimes referred to as the point-in-time count. There's 2 different ways this measure looks at data. The first one is the biennial unsheltered count. It's the unsheltered count and then the annual sheltered count. So the big one that we always hear, the 2,436, that's the biennial every other year count. It also looks at the unique number of people who accessed our system. So there's just 2 different ways for us to look at data. Measure 4 is employment and income growth. Again, this is the way HUD likes to measure our system, our community. As you can see, there is 2 different things that we're actually looking at. One is earned income and one is non-employment cash income. So non-employment cash income is exactly what it sounds like. It's CalWorks or, our cash benefits that we have, WIC, things of that sort. And then, of course, there's the earned income, which is jobs mostly. This is an area that I think our community probably could do better, and I do want to set some standards and goals surrounding this particular measure. But looking back in all of the contracts that we randomly pulled from Legistar, almost no department, at least from the ones we pulled, is setting a goal for increase in income. Measure 5, it helps us understand how many people are entering into the homelessness response system for the first time. A high number of first-time entries may indicate gaps in prevention, early intervention, or broader housing stability supports. Going back to what Supervisor Daniels had said earlier, the partnerships with the Housing Authority is really important because some people are paying way more than 50% of their income just for rent in this community. There are programs that the county offers for homelessness prevention. However, those funding sources are for very specific populations, and our office will continue to explore opportunities for us to broaden that scope a little bit. Measure 7A looks at successful placements from street outreach. Street outreach often gets pulled out when you're looking at data because it is a very specific type of intervention. You're helping people and trying to get them placed straight from encampments. The way HUD and the state of California looks at street outreach is they definitely pull the information out. As it stands right now, there's about 31% of people who touch street outreach that do get connected to some sort of interim housing project or a permanent housing project. And Measure 7B looks at the successful placement in permanent housing and retention. This measure applies across all housing interventions and helps us understand how well programs are supporting people to either exit or retain their permanent housing. The interesting thing is that when you look at the green bar at the top, that is our retention rate for rapid rehousing and permanent supportive housing. What this data tells us is that rapid rehousing and permanent supportive housing are the most effective ways to get people out of homelessness and permanently housed. And I think that there's a lot to say about that because there's nothing more effective than addressing homelessness than giving someone housing. So moving on, the State of California also has their own performance measures, which are almost identical, but kind of out of order as HUD's. The one thing that's different with the California measures and HUD's is that California also looks at breakout data for specific populations. They also look at gender, race, serious mental illness, substance use disorder, veteran status, and victims of domestic violence and age. So the state of California is very much interested in looking at the disparities of certain populations who are being impacted by homelessness and the likelihood of those specific populations being permanently housed. And of course, the Lead Me Home plan, which is near and dear in my heart, as has been alluded to earlier today. There are really 5 specific measures in the Lead Me Home plan that we need to be focusing on. The homelessness reduction targets, entries from literal homelessness, length of stay, which also are in the other 2 system performance measures, the exit rates to permanent housing. The big difference with the Lead Me Home plan is there's also the development of permanent supportive housing and extremely low affordable housing. So after all of that analysis that we had done over the past year and a half, we have come up with recommended local measures. Again, our office did not do this in a silo. We worked with the continuum of care, and as such, the Leadership Council did approve these local measures. So the COC has already started rolling this out. We have worked with the City of Salinas, who, because their homelessness programs are only under one office, they don't necessarily have to do what we're doing here, which is asking for a county-wide direction. But here we are today working with our board to see if this is something that we would be interested in adopting ourselves. And actually, that concludes my my presentation. So I'm here to answer any other questions you may have.
I'm going to take it out to public comment first. Any public comment on this item? I am not seeing any. We'll close public comment on this item and bring it back to the board.
I'll just say that I do support the adoption of this recommendation. I think it's a really good idea and necessary. So thank you for your presentation.
Thank you.
So I'm going to, one question here, and I'll play a little bit of a devil's advocate. On these metrics and evaluations here, I'm wondering how more difficult cases will be evaluated or more easier placement. It seems to me it's going to be maybe be encouraging the placement of the easy ones to meet these standards, while more difficult ones may get less attention and shoved to the side. Is there a way, or was that addressed, was that discussed, and is there a way we can try to balance this off, maybe even having two paths, realizing, well, these are the easy ones, and I don't know if it's that easy to identify them, that, for this set of metrics, but these are the harder cases. I don't want to neglect those harder cases and that's what my concern is by having, somewhat of a standardization and metrics in there.
Sure. Well, I think that there's two parts to my answer. The first one is that we already we did look at how the system is currently performing, and we didn't want to set goals that were completely unattainable. I think that that's important, is you don't want to be unrealistic about what you're asking our service providers to do, especially in an environment where there are essentially no housing vouchers. We don't know if HUD is going to move forward with deprioritizing permanent housing over transitional housing. There's a lot of factors at play, but it was important that we looked at the way the system is performing now, and also looked at are these goals actually achievable? Again, that's a long way for me to say the same thing. The second thing is that we are bound by Housing First. It is California law. That means that we cannot discriminate against individuals for their criminal backgrounds unless they're around children. It's very specific types of crimes that we can actually decline somebody for in our services. We can't discriminate against people based off of their immigration status or their substance use history, their eviction record. The state does not allow us to disqualify people, and as funders, which our office and many departments, we are stewards of state and federal funding. So if the state says that we're not allowed to decline individuals or deny individuals, and we found out that one of our service providers it is really incumbent upon us for us to ensure that that organization is not essentially breaking the law. So I do think that I don't want to. It doesn't mean that we should stop serving these individuals that are more difficult to serve. I think what it means is that we need to make sure that all of these right partners are at the table so that we can still serve them and still focus on the ultimate goal of having a high-performing system. It's always our goal.
That's just my concern is not that it would be deliberate, but sort of unintended in a way as more difficult. And I mean, as long as we're aware of that and moving ahead, I know we need to have standards to do this on, but there's always, when you set forth some standards or a process, there's always little gaps. And it's just good to be aware of them as much as possible. Thank you.
I think we'll want to revisit this every year and bring back any changes to the board if we do see that there is interesting new trends after we adopt this.
I'm fully supportive. I think it's important that we're really clear about our expectations, and then the reporting that we do, it can get cleaner and cleaner over time. I think, it was one of the questions as we looked at the data, was like, how clean is the data that we're looking at? And I don't know that we have a, clear answer on that, but as we continue to use the system and know that it's going to be used for accountability purposes, I think we'll get cleaner data over time. And going back to the BHSA conversation, one of the big factors for that space is sort of the ability to track data across systems. We have, I think, a multitude of different electronic health records that are used by different systems, and the CARS, the HMIS system that doesn't necessarily track diagnoses codes that would show who's eligible and how that all crosses, how those systems cross function. So I think we're moving in the right direction, and I would even go so far as to say that I think we also need to look at all of the different county funding the county funding mechanisms that we have available to us, both in terms of, the 4-H committee looked at all of our contracted agencies a year ago, and we have a number of different contracted programs that we funnel state and federal money through the county to, whether it's a community action partnership, the CDBG funding. They each have their own federal and state requirements that we have to follow, but I also think that there's an opportunity for us to align those local funding systems with these bigger picture goals that we're trying to achieve. We could touch and impact a greater number of individuals who have the greatest need if we could better align those funding mechanisms to be really clear about within the systems that exist. For those plans, how do we include and cross-reference between the two? Because in that collective impact model, you can have a pretty significant impact if we get really clear about what our goals are. So just want to say thank you for the work on this, and I'm fully supportive. You do need action on this today?
Yes.
I'll be happy to move the recommendations.
Second.
All right, we have a motion from Church, a second from Daniels. All in favor?
Aye.
Aye. All right, approved.
you.
Thank you again for the work, you guys.